could change that idea of what nurses are, that it's so much more than that. Because of the pandemic, I think people are seeing nurses for the great strengths that they really do have. I have been a nurse for 43 years now. In that time, I have done many, many different things. Nursing is very different depending on where you work and what your passions are. And I think that's something that most people don't understand, that you can be a nurse that works on a ward or a unit. You can be a nurse that works in deciding on various health policies. You can be a nurse that works for private companies. You can be a nurse that gets further education and ends up teaching, or as a nurse practitioner like myself, or research. So I think that when people think of nursing, they have that stereotypical idea of a nurse in a white uniform and a cap at the bedside. But in reality, it varies enormously by what the choices the nurse makes. And I think that's the greatest thing about nursing, is the huge opportunities that exist. What I found really satisfying about nursing was the ability to do many, many different things. And the thing about nursing is that if you find an area that's not fulfilling a passion within you, you can move. And nurses today, because of the way the contracts are set up, when you move, you take your seniority with you, you take your experience with you. Continuous opportunity to challenge yourself, to change, and at the same time, you're still caring for other people. That gives enormous satisfaction. And I have to say that I was fascinated by the education, because the human body is amazing. And learning about all the systems that we have and how one thing impacted on the other really fascinated me. And it took about 6 months before I really got dug into it and thought, this is cool. I can do whatever I want with this. In high school, no, I didn't see myself as a nurse. I was very interested primarily in having a good time in high school. However, in the times that I grew up in, which would be, the mid 70s, I also knew that I had to provide for myself. We'll always need nurses. And so you don't have to worry about your job becoming redundant. You get paid well. That's something that you do need to consider as a young woman. Where do I want to be in 10 or 20 years? Whether you're going to end up having a family or not, nursing can give you those kind of financial resources to be able to live the dreams that you want. I traveled a lot, not just for the job, but for interest. And nursing gives you those opportunities. When I graduated from nursing, my very first job was up north. And I had at that time really been fascinated by psych nursing. I thought this is what I wanted to do because I love to hear people's stories. So I went up north planning to work in a psych unit. That's what my job offer was. But when I got there, the head of nursing said, no, we need a nurse in maternity. So I ended up that day seeing my third delivery, and on the second day helping a woman deliver all by myself. And it was a process that I thought, my God, I do know this stuff. It was scary and challenging, but common sense really takes you through a lot of things. So I stayed in sort of a women's health kind of service for most of my career. And it has been, honestly, it's been incredibly rewarding. I applied to do a baccalaureate in nursing, and then when I finished the baccalaureate in nursing, I was working with a nurse who was a clinical nurse specialist at the cancer agency, and I just wanted to do what she did. And so I did my master's degree in nursing. And then as I was doing my master's degree in nursing, I started hearing about nurse practitioners, which weren't at all thought of in this province. And about 10 years later, I did my nurse practitioner degree and started with a group of other nurses to get it legalized in Canada, in British Columbia, sorry. My sister being a nurse certainly was an influence. My father was an influence. The other students I was in very basic nursing school with were an influence in keeping interested in it, because we did study groups, we hung together, we talked about everything and about both our fears and our successes. As time went on, there were many other nurses that I met that were highly influential. The major challenge I had was probably the nurse practitioner role. The nurse practitioner was new to everybody. And I had a boss at that time who was the president of BC Women's Hospital. And she was a physician. She was somebody I had quite an affinity with. And I was talking to her about it. And, I want to do things like have a women's clinic, the things that I work with doctors doing. Why can't I do them? And she was one of the people who said, well, if you get the education, we'll find a way for you to do that role. And she did, and I did. I think, like anybody else in high school, I had that stereotypical notion of what a nurse was. Although I did have a sister who worked in an expanded role, who liked teaching and all of that kind of stuff. When I teach nurses today, because I've been in a teaching role for the last 5 years, is they were all surprised about having to work shift work. And I think that we focus a lot on that shift work, it's horrible and hard to recover from, and all of those things. I wish somebody had talked to me really clearly about that and had said, you can get through it. There's ways to organize your life. You get more time off when you work shift. You get more money when you work shift. You have the most freedom on night shifts of anything, any other time as a nurse. I made my best friends on night shift. I remember feeding babies in the nursery in the days when we used to do that. And, just talking and talking and talking and cuddling babies. And I remember, again, just the freedom of night shift.